Hair loss sign not to ignore. Well, hey guys, in today's video, I want to talk about a sign of hair loss you don't want to ignore. Why? Well, if you recognize this hair loss sign early, the good news is that it can be stopped and reversed with a really simple and free techniques. Hair loss is very distressing to go through. There are many different types of hair loss out there. Knowing what type of hair loss you are dealing with is the most important part of slowing down, stopping, and/or reversing your hair loss. Now, I see so many people try out popular treatments, remedies, supplements, spending a lot of money. While there are actually many fantastic, evidence-based, and affordable at-home hair loss treatments, many of which I've discussed on this channel before, check out my hair care playlist, they're not going to work for everyone. One of the main reasons they fail is that your type of hair loss, the diagnosis you have, is one that the particular hair loss treatment never was meant to address in the first place. You know, it's really sad because some types of hair loss are going to improve on their own without any treatment. So trying all of these different things, it's not only a waste of time and money, but you're just exposing yourself to the unnecessary added risk of side effects. Really, the main thing in your case might be just tincture of time. Getting an accurate diagnosis of hair loss is not always straightforward, however. As a dermatologist, diagnosing hair loss is bread and butter dermatology. But even with years of training, experience, seeing hundreds upon hundreds of thousands of patients with hair loss, diagnosing hair loss can still be really challenging and not straightforward. It's really important to ask the right questions from patients, get a good history about their family history of hair, what kind of hair care practices they do, hair styling products they're using, do they take any medications, and let's not ignore the power of a good scalp exam. Using what's called a dermatoscope, a little handheld magnifying glass, to really look carefully at the scalp and the hair follicles really provides rich information on what type of hair loss you may be dealing with. We also can do something called a hair pull test, which is exactly what it sounds like, basically pulling at your hair and looking at the types of hairs that we pull out under the microscope. A good physical exam is not just limited to looking at the scalp and hair, but also involves looking for clues elsewhere on the body, such as your nails. Even your genitalia may have corroborating findings to go along with a possible diagnosis for your hair loss. And in a lot of cases, many cases, it requires blood work to look for abnormalities that go along with certain types of hair loss, like thyroid disorders, low iron, vitamin D. And a scalp biopsy can be high yield and is frequently necessary to get the right diagnosis. In fact, sometimes multiple scalp biopsies over time are required to get the right diagnosis. Why am I boring you to tears with all of these clinical details? To illustrate the point that it takes oftentimes a lot of information gathering to make a diagnosis of hair loss. And I know what you're thinking, hey, I saw a dermatologist and all they did was walk in and say, this is what you have. They didn't do any of these tests. They didn't examine my scalp. True, that's possible. You know, a lot of hair loss types are such that your dermatologist can make the diagnosis just by looking at you. And with at most 15 minutes to a given clinical exam visit, at the most, you know, your dermatologist, it's in everyone's best interest to not waste time and to cut to the chase. So to move on to having a more fruitful discussion with you about, you know, treatment options, how to use them, side effects, etc. All that to say, what I'm really trying to say is that trying to self-diagnose your own hair loss, it's like trying to build your own airplane to go on vacation, crash and burn. Self-diagnosing is problematic. And along those lines, self-treating can not only waste time and money, but also put you at risk for those side effects. Not to mention, the longer you delay getting an accurate diagnosis, you're also delaying getting the best treatment. And the longer that is delayed, the less likely the treatments have to work. Say, for example, Susie Q, the influencer, swears up and down that some $30 scalp serum was like the only thing that regrew her hair. She's trying to convince you that you need it. You decide, yeah, I think I'm going to give it a try. But what Susie Q didn't tell you was that the hair loss she was experiencing wasn't actual hair loss, but rather increased hair shedding in relation to her history of running marathons, training for marathons, marathons a few years ago. She also has a history of starting and stopping numerous forms of oral contraceptive pills. And only recently, like over the past 6 months, she's really cut back on her marathon training, and she's finally on a form of birth control pills that she likes, that works for her. So of course, her hair shedding has stabilized, but she has just assumed that it's the serum, and she's trying to convince you that that's what it is. But really, it's that she's removed the causative factors in her life and things resolve on their own as expected. I'm not exaggerating. This scenario is a lot more common than you might think, especially on social media. So don't believe everything that you see on social media. Question and remain skeptical. So you decide to buy the serum. The serum probably says something to the effect of may take 4 to 6 months to see results. So you think in your mind, I'm going to try this. Why not? What do I have to lose? You have 4 to 6 months to lose. That's what you have to lose. 4 to 6 months of putting off the correct treatment in favor of trying out the serum. It could take you so many steps back, allow the hair loss process to progress untreated. So by the time you finally get in to see a dermatologist, it's a lot harder for the treatments to work. So then, did I clickbait you with the title and intro? No. While hair loss can be challenging, there is a clue that you can look for, and if identified and caught, you can make some very simple and free changes, which I'll explain how to do at the end of the video, to stop and reverse the process. What is said magical sign? It's called the fringe sign. Basically, you have a fringe of what looks like finer baby hairs that are right in front of the area of hair loss. It looks like, well, a fringe, as the name implies. This is a sign of a type of hair loss called traction alopecia. Traction alopecia is hair loss caused by prolonged or repetitive tension on the hair, such as wearing tight braids, tight slick back buns, which are really stylish right now. It can also happen with hair extensions. It can happen with wearing certain hats and head dressings. And the location of the hair loss and the fringe sign is going to be to specific areas of the scalp where there is that traction. It's most commonly seen on the front of the scalp, the temples, and behind the ears, like due to tight ponytails, tight buns, tight braids. It can also be seen in the back part of the scalp called the occipital scalp. Like you might see that with somebody who wears a tight bun or a tight French twist. Now, hair that has been chemically processed, such as from a relaxer, is a lot more vulnerable to traction hair loss than natural hair. Now, the thing about traction alopecia is that you can stop it and reverse it if you catch it early on. That's why this sign is so important. However, the longer you put traction on those hairs in those spots, you risk the traction alopecia progressing and scarring down of the hair follicle. The fringe sign can be seen in both the early and late stages of traction alopecia. Now, if you have made it this far in the video and you feel betrayed because this does not apply to you, you have already looked at yourself at this point and you don't see the fringe sign, this information is still valuable for you to know. Why? Once you know what the fringe sign is, you can easily spot it in some of those before and after photos and advertisements for various and sundry hair loss remedies. Once you know about it and you know what to look for, those before and after photos, they become far less convincing. All right, so it's less tempting to buy those hair loss products. So what can you do to stop and or prevent traction alopecia? Here are some tips. Number one, just say no to painful hairstyles. If you pull your hair up and your scalp is in pain, that is a sign you need to undo that hairstyle. If you wear your hair in braids, consider switching up the direction in which you braid your hair. That can offset that chronic traction on the hair. Or if you're someone who wears tight ponytails, consider switching to a looser ponytail, a low ponytail. Try wearing your hair down for a period of time. If you get a relaxer or you chemically process your hair in any way, avoid traction hairstyles on relaxed hair, or at least wait to do them 2 weeks after processing. Relaxed hair is a lot more prone to breakage and a lot more vulnerable to traction alopecia. With relaxers, the damage increases with increased exposure duration. So make sure the relaxer should be applied only according to package instructions, taking care to only process the new growth or the virgin hair. Don't go smoothing the cream through previously relaxed hair. In addition, the hair should be thoroughly rinsed and neutralized after processing or immediately if there's any scalp tingling or burning that occurs. Using both relaxers and dyes can compound the hair damage. So avoid dyeing the hair at least 2 weeks after doing any kind of relaxer. Avoid or minimize heat on relaxed hair. Air dry or use the hair dryer on a low heat setting. Don't use hot combs or flat irons. Very high temperatures can cause significant hair damage. This is not the first time I have talked about how to stop and reverse traction alopecia. On the end slide, I'm going to link a video for you that gives even more hair care tips to prevent and reverse traction hair loss and hair breakage. So definitely watch that one next. But if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.